Okay, you should be good.
All right. Thank you. And welcome to our third installment of a regional report out from Northwest Kansas. We will be here every Tuesday at 3:30. And if you can't make the call, please sign up with your email at our website, which is covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. You can also see the map of the regions if you want to see how the state's been laid out from a healthcare standpoint. Governor and state leadership have asked us to do this so you can understand what's happening in your region with your healthcare system, your hospitals, and a couple other things on the top here. If you want to ask any questions or offer comments for our next call, you can reach out at KS Regional Report. That's ksregionalreport@gmail.com. And then if you're looking for a free testing site, that initiative is going off and strong. I just heard was on another call where we've gotten 10,000 more tests a day going on in the state. If you go to gogettested.com/Kansas, that's gogettested.com/Kansas, you can find a free testing site near you. There you go. So I will run through our dashboard that's provided by the Kansas Hospital Association, our friends there, and then we'll get some color from our additional guests here on the call. So let me see if I can share. Megan, if you could make me the host, I'll pull up my screen for everybody.
Sorry,
Whoa.
I couldn't hear.
Apparently Siri's listening to us. All right. Let's see. I don't think Siri can do that, but Megan got it done. Here we go. Okay. So this dashboard will be attached to the email if you sign up for the email. It is dated December 28th, as you can see there at the top. And these are static numbers that you're looking at that live in a dynamic and changing environment. But overall, you'll see a good story here out of Northwest Kansas compared to what we've been seeing the last couple of weeks. So 18 hospitals report in this region. Only 4 or 22% were anticipating issues with staffing this week. And we know it comes down to staffing, stuff, or space. At the hospital, staffing has been the pinch point most recently. And then you can come through and see a little census of the patients with COVID. And then we like to come look at adult ICU beds that are available. And 10 of the 24 in the region are open yesterday, and that is 42%. And then only 1 ventilator use, so there's plenty of ventilators there. And then I'm going to be working on this COVID death stat. I think it's just the trailing day, but I want to make sure that we know more about that. So more on that next week. You can see the new daily cases here had that spike in November, and then we've just had a steady trail down. We don't know if that 255 number, the holidays tend to mess up people getting tested and all that, but that's good news as it stands. I also want to flip over and show everybody KDHE has put together a chart for us here to show positivity rate. It's on their website. If you go to hospital capacity and then HCC regional percent positive, they broke it down into our regions here for us. And if you look in the Northwest region here, you can see the number of tests each day and the positivity rate. And again, a good story going on here. If you come after Thanksgiving here in December, 2,400 tests a day, of which 14% were positive, 2,100 tests, which 10% were positive, 1,300 tests this last week. So you can see how it dropped because of the holidays there. And that's what we're seeing in most of the regions, where about 2/3 of the tests were probably taken given normal rate, but still 12.5% positivity rate. So those numbers are still higher than what we'd want, but they are trending better, as you can see from the red. Early yet this week, only 77 tests logged in, but a 5% positivity rate on those tests. So good news so far out of the Northwest region. And then here on the second page of the dashboard, you can see the percent of the population that is tested positive from that county. looking around all Northwest Kansas here. And then you can see the census of the ICU beds with COVID and non-COVID patients and what's available. Important just to look at this, given that this time of year, hospitals sometimes can be their ICU beds near capacity just on non-COVID patients. And so just a lot of work being done, getting patients around where there's capacity and all that. So that is our chart for this week. I'll come back here to our group, and I'll pass it over to Reagan to give some color from the hospital side. Reagan?
Hi. Just a quick report for everybody this week.
Where you're from? I'm sorry, Reagan. I should.
That's okay. I forget our what we've been coached to do. I'm Reagan Kusmani. I'm the Director of Governmental Affairs for the University of Kansas Health System, which includes Hays Med in Hays, Kansas, as well as Great Bend, Larned in Pawnee Valley and Larned, St. Francis, and the University of Kansas Health System campus in Kansas City. So we have kind of watched overall in our health system kind of a slow decline around the number of COVID patients we've had over the last week. So early last week, we were at about 173 in our Kansas City campus. We're down to about 100 in the low 120s so far this week. Similarly, we had been up pretty high in Hays Med, and I'm checking my list today, and it looks like we're at about 27 with 21 who are active and 6 who are recovering. In Great Bend, we have 2. In Pawnee Valley, we don't have any, and we've run 1 or 2 in that facility for the past few weeks. So that's a good trend. Maybe not a trend that we'll see continue through the next few weeks after the holidays, but it is, I think, something that we are all appreciating, a little reprieve from the higher numbers. And so there you have just a little bit of a glimpse of what's going on in the hospitals. I think you guys talked a little bit about it this week. Vaccines are rolling out among the health system. And so we are hoping to continue to do that in a very effective and judicious manner to make sure that everybody is getting vaccinated who are frontline and essential first, and then we'll move our way through the system.
Thank you very much, Reagan.
Sure.
And we just had Paula join us from Russell County Health, and while she is getting situated, Reagan, do you want to pitch it over to Shelley to have her give some color from?
Absolutely. Shelley Bowden is with the CARE Collaborative, which is part of the University of Kansas Health System. She has the pleasure of working with a number of Northwest hospitals, and she is going to kind of just give us a little glimpse of boots on the ground and how things are looking at the various hospitals here throughout Northwest Kansas.
All right, thank you, Reagan. Hi, Paula, it's nice to see you. I did talk to a number of hospitals today from out in Northwest Kansas, and they too are having a reprieve. It's much slower than it was the last 2 weeks. They've seen slowing trends. Decrease. They believe there's less testing. They know the numbers are down, but they also think that there's a lot of less folks not getting tested over the holidays. So they're anxious to see once people start, or hope people continue to get tested regularly so that they really have a better understanding of what's in their community. I'm hearing, their beginning is, like you said, slowing down, which was great because they started the vaccinations, which was a process to get done. But as many vaccinations as they were able to give, they have gotten. There has been some frustration at one facility on vaccinating their long-term care. Their long-term care had requested the vaccinations, and they haven't received them. For those residents that haven't had COVID, the families and loved ones are anxious for them to receive the COVID vaccination, and they're just frustrated with that, but talking to the state to see what's going on there and why they're not getting their vaccinations as requested on the long-term care side. Still some issues with transfers. Colby had said that there's still continued issues of transferring patients to Hays, Salina, and Wichita, but Denver transfers have improved. Graham County said that transfers have improved overall. And they started using Mission Control, and that has helped them a lot. They were very pleased with the Mission Control app and the benefit of that. Increased number of swing bed patients that are there a long time in some facilities, longer than usual, which is not surprising. And staffing overall isn't bad. They have a few facilities have some staff out, but very limited compared to what it was before. So overall, I would say improvements, as Reagan said. And Rawlins County, the only outlier here was Rawlins County said that their long-term care which is not associated with the hospital, but they of course do work very closely with them. They have lost 5 residents, and they had 25 out of their 30 patient residents positive. So it's been a really big job trying to handle that and wrap their arms around it. They've tried to take some patients for them, but that continues to be a challenge in their community, the long-term care outbreak. So other than that, I think it was overall good news.
Thank you, Shelley. And I was just on listening on a call with Secretary Norman, and I know that issue was being brought up about the vaccine distribution in some of the long-term care facilities that we're still waiting on them. And so I know it was being brought up to the top, and that they're aware of it and working on that. Now let me pass it off to Paula. Paula, if you can introduce yourself for everybody and just give us some color from the public health side. Oh, and you're still muted there. It's still 2020. That happens to the best of us.
I know. I was answering Shelley and going, hey, it's nice to see your picture too. And then realized she didn't hear me. Hi, my name is Paula Bitter. I am the Health Department Administrator at Russell County. And I just want to say thank you for letting me participate and for the invitation. I've reached out to other, area counties in the Northwest region, and like everybody else, they've seen a decrease over the last couple of weeks, number of cases as well as testing. But I do know there's testing still going on, due to the state facilitating testing sites and everything like that, and people seem to be taking advantage of it. But that, like I said, they're still seeing a reduction in not only the number of positive cases, but in the amount of testing done. It's actually a nice little break for all of us, from all the contact tracing and investigations we do have to do. So the slowdown, we're not complaining about or anything. It will be interesting to see what happens now, after the holidays, and see if we get another surge. I know in Russell County, just a little background, our highest test rates were back in November, kind of when everybody else was having that big surge. And since then, we've seen a steady decrease in both positivity rates and our cases, through the whole month of December. It's gradually came down. So I don't know if the anticipation of the holidays had an influence on that, or if good portion of our public has been tested positive now, or what's going on. But we did have have seen a decrease. That's about where we are on our positivity rates. I do know we've had a little increase here within just the last couple of days, and so our positivity rates right now is not looking good, but there's people still getting tested, so hopefully they're negative. We did get our vaccine delivered a week ago Monday here at the health department. And the Friday before that is when the hospital received their vaccine. We started vaccinating last Monday, the health department employees and EMS. And it works out very, very well. The only drawback is you have a limited time span of when you take that first dose out of your vial. So you need to have 10 people lined up to be vaccinated so you don't waste any doses. And that's what we had to do. So we've only vaccinated 10 people here in town, and we've got 7 on the waiting, that are ready to be vaccinated. I need to find 3 more. but we have started vaccinating. Nobody's really in the counties had a very serious reaction, just the typical, headache, swollen lymph nodes, that type of thing. No major reactions. With the vaccine, there is kind of a boost in morality because people are seeing that, okay, maybe something will be, something is happening that will put an end to what we've been dealing with for the last 9 months. It's like a light at the end of the tunnel type of situation. That goes from healthcare and for the public both, everybody's remaining hopeful. We tell people, even though you do get the vaccine you still have to continue your best public health and safety measures, not only for themselves, but for their family and for the rest of the community. We also do get some resistance because we cannot tell them exactly when they can get vaccinated. They want us to put their name on a list. And so that's kind of frustrating for them. But I found out that if you can be, the more transparent you are with your community, the better they are, the more they're receptive to what you are saying and everything. So I tell them, as soon as I know something, it will be on the radios, it will be over social media, something like that. And then I just want to say, local health departments have been have plans in place for, point of distribution centers like this, like what we're going to have to encounter. We've been working on plans and redoing our plans, revising our plans for years now. So hopefully everybody has that in place. And when we do get our community vaccine, that the distribution points will, go smoothly, like our plans say they do on paper.
Well, thank you, Paula. And when you said you're looking for 3 people to fill out your list, I'm assuming, just so we don't get hammered by emails, that's not an invitation to the general public.
No, I'm sorry, it's not. I've reached out to see if I can start vaccinating some of my ancillary, healthcare providers, like my long-term or my home health staff, and people like that.
I think as far as an expectation set, I was hearing the Dr. Norman, Secretary of Health, talk about probably it's going to be healthcare, public health, and long-term care, through most of January, and then you'll start seeing the over 75, over 65 in February and March, and but they're working on a list that they'll present to the governor in the first part of January, as far as the categories and how to roll out across Kansas. So, Paula, thank you very much for that report out, and I think it was, you heard Shelley mention the Mission Control app and that going well. We have Dr. Watson, who's practiced medicine in Kansas for a long time and is a co-founder of Cheyenne Mountain Software, which is the Mission Control software, which deals with the transferring of patients. We had him on last week, and he has some regional specific data for us to share with what's going on with the transfer of patients. Dr. Watson.
Yeah, thanks, John. And thanks for allowing us to show what we're seeing here. I'm going to pull up the dashboard for the Northwest region and just talk a little bit about what we're seeing. I think globally we are seeing numbers that are better than they have been before. Certainly the volume of transports has improved. The severity is down somewhat, and the COVID positivity or suspected positives are down. So we were up around 40% of the transfers were COVID suspected. We're now sitting right at about 35%. Of those, we're asked to find placement beds for about 35, 36%. I think it's interesting that if you're just all comers looking to move somebody, the wait is about an hour and a half to get EMS, to get the bed placed and EMS on site. But if you actually look at people who don't have a place to send them, we're up to 2 hours. And this is Northwest region, much better than a lot of the rest of the state right now. I think we're seeing 3 and 4 hours in other regions in the state. And certainly this is definitely an improvement of where we were. As you can also see, the percent COVID positivity and the acuity also decreasing. But still, we're running 60% of the time we're looking for beds for COVID patients. So I think overall we're encouraged, particularly by this part of the state, that this may represent a true downturn, and hopefully that everybody moving around to the Christmas holiday won't disturb that trend, and that as we roll into January, that we'll actually see improvement. But everybody's taking a breath, knowing that a lot of people were moving at Christmas time, and we'll see how that shakes out for actual cases.
Thank you, Dr. Watson. All right. Well, before I kind of bring in some closing comments, I just didn't know if anybody, Reagan or Shelley or Paula, have anything you'd want to add after hearing what everybody else had to say. Right. All right. Well, I got a couple just announcements. You know, there are people who take advantage of times like this. And with the vaccine rolling out, there's also vaccine scams that are rolling out. So just 3 bullet points from our State Department of Health. And you may want to remember these and share them with people you know that might be susceptible to it. But here's 3 things. 1, you will not be asked for money to enhance your ranking for vaccine eligibility. So no one should be asking you for money to move you up in line. Also remember, government and state officials will not call you to get your personal information in regards to the vaccine. So don't be giving your personal information out over the phone. And number 3, you will not be solicited door to door to receive the vaccine. So no one should be coming knocking on your door, talking to you about giving you the vaccine. So unfortunately, there's people out there doing this, and they do it because it works sometimes. So please help spread the word that don't be giving money over to bump up in line. Don't be giving your personal information over to anybody pretending to be a government or state official. And no one should be coming door to door to solicit you on that. We'll attach that to the weekly email that goes out also. And then also we're hearing from the Kansas Chamber of Commerce that there's a lot of unemployment fraud going on out there also, has been going on through the pandemic. And it's happened to me twice, but just something to be aware of. If you're, okay, we're all participating. If you are employed by someone, that may be happening to you too, all across the state. So there's a process to go through, and just look at the Department of Labor. And if we have more information on that, we'll share that with you. But just something also to be aware of as far as some of the pandemic related scams that are going on out there. We like to end with a bright spot. I don't have one specifically from the Northwest region again this week, but close in Hutchinson, Kansas. Someone grabbed a group of kids and did some chalk messaging at the staff entrance and exit of Hutch Regional, giving messages of encouragement. And we had a nurse from there on earlier, and he was just saying how meaningful that was, and just great to see someone inviting others into kindness and light and goodness in this time, and seeing how meaningful that kind of thing is. So just a bright spot. I would like to catch people doing something right, and just be reminded that we all have the opportunity to bring a little light into the world. So I want to thank everybody for their time. This call will be live every Tuesday at 3:30. This is the Northwest Regional Call. And again, you can sign up for it at covid.ks.gov/report-outs. And you can send us a message at ksregionalreport@gmail.com. I want to thank you all very much, and we will see you next year, I guess. So, but next Tuesday at the same time. Appreciate it, everybody.
Happy New Year.
Happy New Year.